Good morning or afternoon or whenever it is you're listening to this or watching this. So today we're going to talk about ACL surgery, or rather we're going to talk about non-operative management of an ACL tear. And this is a bit of a controversial topic, and in order to prepare for this I did a little bit of research and I found articles on both sides of the issue. And that's kind of the norm. So this gets into one of those areas of practice that the norm, or just doing it because we've always done it, has got to start to be questioned. So this actually came up for me in a very unusual circumstance. I mean, literally over a decade ago. I had a patient who was a professional baseball player, and he had torn his ACL in the off season, but he didn't have a contract for the next season. And he knew if he had his ACL replaced, that no team would sign him to another contract. But he needed 2 more years in order to get his full pension. So he asked me if we could rehab his knee without an ACL. And up until that point, I would have said absolutely not. You're an elite athlete, you have to have the ACL repair, that's how it's done. And this is why we have to question those things sometimes. At that time, I did some research and read every article that I could find on the subject, and every review article and every article written by an orthopedic surgeon said exactly what I thought. It has to be done. But when I read some articles about the actual science and the biomechanics of what was going on, and when I really considered whether or not you have to have that ligament in place, I started to question that reality that you have to have it done. And what I found was that in groups of people who tear their ACL, only about 50% of people who tear their ACL have it replaced. It turns out if you're older and more sedentary, you're less likely to have it replaced. And younger and more athletic tend to have it replaced. And that's what all the review articles say. They all say, younger athletic, have to have it replaced. Older sedentary, don't worry about it. So of those people that don't have it replaced, people get dropped into 2 categories, copers and non-copers, people who can live without it and don't really have any side effects of it, and people who can't. And it turns out that if you do rehabilitation, you could turn most non-copers into copers. So that started making me think, well, do we actually need this? Who's more likely to cope, old sedentary or young athletic? Young athletic. They have the ability, they have the strength, they have the neuromuscular coordination to be able to cope without it. So then I started asking, well, what's the purpose of the ACL? What's the purpose of the replacement? So the purpose of any ligament is, 1, to prevent passive motion, or to act as a passive restriction to motion. Well, once you've replaced the ACL, my job as a physical therapist is to make sure that that stress is never placed on the new ACL. The new ACL only ever gets to be about 80% as strong as the original. So I never want any passive stress placed on it that would be even equal to what was originally placed on the original ACL. So I can do that without the passive restraint to motion. I can do that without the physical structure there. The other purpose of the ligament in its original form is to act as a sensor. It turns out when you mechanically deform the ACL, your hamstrings reflexively contract. So it's a sensor that tells the hamstrings, hey, we got to pull hard on the tibia and protect this translation and stop this tear. You never get that back, whether you have the surgery or not. You don't reinnervate the new ACL, so you never get the sensor back. So again, I don't need it. I don't have to have the surgery in order to get that aspect. Once you torn the ACL, you lose that aspect. And my rehab post-ACL surgery is going to be focused on making sure you never place that stress on the ACL again. I don't need the ligament there in order to do that. So let's get into what does the evidence say. So there was one article, a review article, written primarily by orthopedic surgeons, and their end statement is that not only should you not have the surgery, you should have the surgery, but that there are all these negative consequences to not having the surgery. And one of the things they point out is that fewer people who don't have the surgery return to competitive sport. However, according to this other article, only 56% of people who do have the surgery return to their prior level of competitive sport. So you're really less likely to return to that level of sport regardless once the ACL is torn. So I'm not sure that's such a strong argument, but their end conclusion, and I want to make sure that I'm presenting both sides fairly, is non-operative treatment of ACL injuries can certainly be discussed in less active patients. However, anything short of offering a young, active athlete early anatomic ACL reconstruction would be a disservice to our patients. That's their stance. Now, this gentleman that I treated was not all that young, but he was certainly athletic. He played 2 more years of professional baseball without any problems with his knee. This was 15 years ago. He still does not have the ACL replaced. He still has no problems with his knee. So it can be done in an athletic population. Of this, I'm certain. Since that time, I've had 2 other young athletes that chose to forego ACL surgery. One of them ended up still feeling a sense of instability in his knee, and he had the surgery. The other one never had the surgery, went on to continue to play collegiate soccer without any problems with her knee. So again, it can be done. The other thing I want to point out is that non-operative management of ACL injury doesn't mean you do nothing. It means you do rehab. And these studies that they talk about when they compare the non-operative management to the surgery, they're talking about people who did nothing after their ACL tear. So yeah, no, those people don't recover well, they don't do well. If you do nothing, you're not going to do well. So I'm talking about doing some form of rehabilitation. And the evidence on that is if you do rehabilitation prior to an ACL surgery, you have better outcomes from your ACL surgery. So what I'm suggesting is that you at least give rehab a chance before committing to the surgery. And the last thing I'll leave you with is this article by Wellstant, Falia, and Axe in 2018. And they found, and they were studying patients 5 years after ACL surgery or non-operative management of an ACL tear. And they found the difference 5 years later, patients treated with ACL reconstruction versus rehabilitation alone did not differ in quadriceps strength, performance on a single leg hop test, activity level, subjective reports of pain, symptoms, activities of daily living, and knee-related quality of life, or presence of knee osteoarthritis. So what they found was surgical management was no better than non-operative management as long as some rehabilitation was performed. So if you have questions about this, if you're considering ACL surgery, I ask that you consider otherwise, and if you have any questions, please contact us at Pro Performance Therapy. Thank you very much. Have a nice day.